everyone, my name's Davies and I'm from Oxford Brookes University. So today I'm going to be talking to you about some findings from the Global Drug Survey. So hopefully what I'm going to do is share my screen with you and present to you some slides, which of course I will make available afterwards if anyone would like them. So hopefully you can see my screen. Before I start talking about the findings, I just want to acknowledge all of the co-authors of this particular study and everybody who's involved in the Global Drug Survey who worked really hard to put all of this stuff together under pandemic conditions and lockdown and all sorts of things going on. So it's been a really positive experience and a really wonderful collaboration to be part of. So I probably don't need to give too much background about what's been going on, but way back at the start of the pandemic, the World Health Organization recommended that we should avoid drinking altogether. Of course, we know that alcohol has impacts on our physical health, but also impacts on our mental health as well. And despite this, in the UK, when all other shops, businesses, sports, all types of things were being closed down, alcohol selling off licenses were deemed essential services in the UK. And now this, of course, is an essential service for people who are dependent drinkers, for whom stopping consuming alcohol abruptly may result in really negative consequences. But for a lot of people, then stopping drinking wouldn't actually result in negative consequences to them. Despite this, in the run-up to lockdown, compared to the same period previous year, there was apparently an extra £160 million spent on alcohol. So there was something happening there that people were deciding to stock up, of course. We were very interested in this together with James Morris, who's based at London South Bank University. We wrote a little piece about that. So if you're interested, you can have a look at that later on. But I'm here today to talk about findings from the Global Drug Survey. Now, normally, and for quite a few years now, the Global Drug Survey has been an annual survey, so once a year. What we normally do is run the survey from November to December, then I'll start analysing the data at the start of the year, and then release an annual report every year around May time, and then we'll be writing up our findings and hopefully getting some impact from those findings. But everything has been disrupted this year, including the release of our findings. We'll be releasing the Global Drug Survey 2020 findings in November when we release the next survey. But in the meantime, when we were all going into this situation, we started thinking about what would happen to people's drug use and what would the impacts of these sort of lockdown conditions and any changes to people's drug use be. We're particularly interested in mental health and in relationships. So I'm here today to talk about the alcohol stuff, but there's plenty of other information and I'll point you towards that at the end of the talk. So it's every time we run the survey, it's completely anonymous. It runs online in an encrypted platform. And this time the survey ran for 7 weeks in May and June this year and was translated into 10 different languages. So there's lots of people involved in the background there translating the survey as well as developing the survey, running the platform and things like that. And in line with previous years, we recruited via media partners. So for example, if you might be familiar with the online news service Vice, they often run stories about Global Drug Survey and we recruit through them. And there are similar partners all around the world. We also have partnerships with harm reduction organisations who will promote the survey as well. Now, of course, this results in an opportunistic sample. So it's a non-probability study. It's not representative, and we can't make claims about the wider population of the countries of the people of which take part. And also, the respondents to the Global Drug Survey tend to be younger, and they have more experience with illicit substances than the general population. However, previously, some of the team members have run a study comparing the people in the survey who take alcohol and the people who take cannabis, and comparing those to people who take alcohol and cannabis in general household surveys, and they are similar demographically. But what you do get from Global Drug Survey is the opportunity to sometimes have a look at unseen populations and spot trends in emerging drug use. So the survey questions in this particular edition were around all sorts of things relating to lockdown, so alcohol, other drugs, mental health, coping, lockdown status, going out, family finances, pets and more. But specific to alcohol, We asked people in the last 30 days how frequently they had consumed alcohol, how many drinks they'd had on a typical occasion, and how many times they'd had more than 5 drinks on one occasion. And then we asked them, compared to February before the lockdown, whether these things had changed. And if they had changed, we asked for the reasons why they changed and what were the impacts of those changes. So now moving on to talk about this sample. So after cleaning the data and after looking at complete responses, we ended up with a global sample of 55,811 people. And this is from countries where there were more than 1,000 participants other than the United States, which we've included, but there was only around 700. There's lots more information about the numbers of people in each country who took part, which I'll point you towards, but it's worth pointing out that, for example, in line with the usual things that we get in usual years, there's around 25,000 German respondents. We do get quite a high proportion of people from Germany who choose to complete the survey. And there were 2,136 respondents from the UK. These people were 82% white, 23% were living with children at the time they completed the survey. As you can see here, we have gender breakdown, only a very small proportion of trans and non-binary people, and we have a third of people who are aged 25 to 34. So in the rest of the talk, I'm going to be comparing in some slides the UK with the global sample, but I'm mainly going to be talking about the global sample here. If you'd like more information, then I can put you towards where you can get that from at the end. But one of the key questions in the survey is to ask people if they've ever been diagnosed with a mental health or developmental condition, and I'll show you which conditions are included in a minute. And this slide compares the global sample with the UK, and as you can see, 48% of the UK people said that they had. Now, we also included the Kessler-6, which is a validated measure to assess severe mental illness. And these purple bar in this particular graph show the number of proportion, of people who actually got a score that would indicate they were suffering from a severe mental illness in the past 30 days. And you can see that that's also higher in the United Kingdom. If we look now at the global sample, we can see the proportion of people who report that they have been ever diagnosed with one of the following conditions, and depression is the most common, followed by anxiety. Now, as you can see here, we've also got ADHD, autism, and things like that in this particular category. So when I'm talking about mental health, I'm talking about mental health or developmental conditions at the moment, and we're just doing some analysis to look at those separately. So this particular slide is for the global. Keep an eye on the proportion of people who report that they suffer from depression or anxiety as I move to the next slide, which looks at the UK sample. As you can see, it's a greater proportion of the UK sample report that they've ever had these particular conditions. So moving on now, I'm going to just quickly present to you some information here about whether or not people have started drinking earlier in the day, just for interest. So if we look at the UK sample, which is this particular slide, if we look at the grey bar at the top, that indicates everybody, and it looks at 44% said they were drinking earlier in the day before lockdown. And as we know, a lot of people were working from home or furloughed or had lost their jobs, so maybe they were drinking earlier in the day for those reasons. So that's very interesting to have a look at. But alongside that, we've got a further graph at the bottom there, which looks at people, whether people answering the question, would they like to drink less in the next 30 days, which we always ask in every global drug survey. And usually around a third of people say they would like to drink less in the next 30 days. And this particular case in the UK, we've got 46% of people, and then you can also see that broken down by different gender groups as well. Compared to the global sample, 30% of respondents said they were drinking earlier in the day, so that a lot more people in the UK were drinking earlier in the day. Now this slide looks at changes in drinking, so we asked people then to compare their drinking to the February before the lockdown. And as you can see here, we've got changes in drinking amount and changes in the frequency of drinking. And the green areas of the graph show where people have increased. And this is for the global sample. So we can see that 43% had changed the frequency of drinking. So they were drinking on a greater number of days. and 36% had been drinking more when they were drinking. It's also worth pointing out that there was a big portion of people who said there was no changes. Now, if we look at composite changes in alcohol use, so this is people who reported any change at all. So that would be in any change in frequency, any change in the number of drinks, or any change in the number of binge occasions. And what we've done here is we've displayed the data comparing people who report having a mental health condition or a neurodevelopmental condition compared to those who haven't. And what we can see is, in terms of the decrease, that's pretty similar. So about a third of people say they've decreased their drinking. But if we look at the increase, then we can see that there are differences in the people with mental health conditions there. So 42% had increased their drinking compared to 35% of people without. Now, there is a few people who made some increases and some decreases, so maybe they were drinking more frequently but weren't drinking as much. And that is something that we need to look into in more detail. Now, in terms of why people said they'd increase their drinking, well, overall, 42% they had more time to drink, or were more bored. And for some people, they were drinking more because they were spending more time with their household, so their partner or family. And it is worth pointing out that just around over a third of people said they were drinking more, but it wasn't a big deal to them. It wasn't something that they were worried about. I'm going to show you another graph on this slide. So this is comparing all of the reasons that we gave to people, the options in the survey for their increased drinking, and comparing those groups of people again. So looking at everybody, and then those people who reported having a mental health condition compared to those who didn't. Now, in terms of the time, I can see that's pretty similar. But for our respondents who reported that they did have a mental health condition, then 47% were saying they're drinking because they were more bored compared to 36% without. Another key trend to have a look at on this particular graph is around the people who reported feeling more lonely, more anxious as well. There's another interesting thing that people also say that they're drinking more as a reward for coping with what's going on, and there are differences there between the people with and without mental health conditions too. Now, this is the graph just very quickly to look at the UK again, and in the UK the rating for boredom is actually quite a lot higher. But it's also key to note that the rating for being more depressed, more lonely and more anxious is also higher in our UK respondents, particularly those with a mental health condition. Now, of course, many people did decrease their drinking, and that's really important to note. When we look at the news and the reporting of particularly our data, it's all about people's increases in drinking. But actually lots of people were drinking a lot less. And some main reason for that is just not having access to people or places where they would usually drink. 43%, so they just didn't like drinking at home without their friends. And a third say just didn't feel like it in a kind of global pandemic situation, didn't feel right to them for some reason. But if we look at these reasons again, when we compare people with and without mental health conditions, actually there are fewer differences here. And there are some differences, but they're quite small. So taking people having less access to settings where they would usually drink, they are quite similar, although the people without mental health condition are suggesting that that's a more important reason for them. But also, again, we have people who say this decrease is slight and it hadn't made an impact on them at all. Small number of people were using time to get healthy. Perhaps that was an opportunity to stop drinking, and maybe being out of social situations was something that helped that. But there's less of a difference there, and there's much less of a difference between the UK sample and the global sample, although those differences need to be explored, and the analysis is still ongoing. Now, what about the impacts of changes in drinking? Because yeah, changes may happen, but you know, maybe that they're not having any impact on people. So it's important to have a look and see what people say about the impact. So in terms of drinking more, so everybody who indicated that their drinking had changed and they were drinking more in frequency, number of drinks, or binge drinking were asked to rate the reasons why. And then we had finances, mental health, physical health, pleasure, enjoyment, relationships, or work or study. So I think another key thing here is that for many people there were no impacts on these things. So that's the yellow in the middle of the graph. But if we look at people who reported one of the mental health or developmental conditions that we listed, we can see that looking at the red, which indicates they rated this domain as worse, then both their mental and their physical health they've rated worse compared to the people who didn't report having a mental health condition. So these were people who were already potentially suffering ill effects, and they were feeling worse. Now, again, if we take the other look at this, which is the impact of drinking less. So in this particular case, you can see that the red bar indicating that things are worse for the person generally are smaller, other than when we look at pleasure or enjoyment related to drinking, because of course if they were, maybe they weren't getting so much pleasure because they weren't drinking so frequently or weren't drinking so much. But for everything else, it didn't seem to be having too much of a bad impact to be decreasing their drinking. Now, if we look at the things that got better, and we compare the people who reported a mental health condition compared to those who didn't, we can see that these people were reporting better mental health and better physical health. Physical health seems to be better for both groups, and the mental health of those people who were reporting mental health condition is better. So what does this all mean, and what can we do with the data? So I will add that this data analysis is still ongoing here. So we've got a lot of things to look at, a lot of things to pick apart. But it seems the headline findings so far is that our participants who reported that they had a mental health or neurodevelopmental condition, and those ones who were drinking more in lockdown were doing so because they felt more lonely or more depressed or to reward themselves. And these participants, it seems, were experiencing greater negative impacts on both their physical and mental health. And what we need to do is understand what would be better coping strategies and how we can reach out to people and connect with them in this type of situation in order to make sure that we can try to reduce those negative impacts on people. Because it's all very well saying, well, you know, if you are suffering already from depression, you know, you shouldn't really be drinking during the pandemic, you should be doing this, that and the other. But of course, one of the main things that is a consequence is that we're less connected to people physically. And of course, we're all learning to do lots of different things on Zoom and all sorts, but it's not the same as actually being with a person and being able to talk to somebody. But how can we harness these powers to actually help people is a really important next step. And of course, as I mentioned when I started talking about the results, we've put people who have specific mental health and neurodevelopmental conditions separately, which is obviously an oversimplification, and we are picking that apart now and having a look separately at different groups. But what we're really interested in is whether these different groups are able to seek the help they need and able to access the help they need, and is it actually appropriate help which helps them and with their specific needs, depending on how they're able to access them, but also that actually relate to the particular condition that they're talking about. And what I really want to highlight as I come to the end of the talk now is that it is really important to remember that 24% of people that had not changed their drinking at all. And again, as I said before, when we look at the headlines of some of this research as it's reported, it seems like everyone's drinking more, which is actually not a great message to be putting out in the media, because obviously then that normalizes changes in drinking for everybody. And it is important to think about how we're discussing this topic, and that we do so in a sensitive way, because how we're talking about alcohol, and particularly what we prioritize in a crisis like the one we're going through at the moment, has really huge implications for what people understand to be normative behaviour, and also their ability to seek help should they need it. Okay, just very briefly, I'll just highlight that there are plenty of other findings that you can have a look at on the website around changes in other drug use, harm reduction, and particularly the interesting findings around intimate partner violence during the pandemic. But I think that's the end of my time, so I'd just like to say thank you very much for allowing me to speak. And if you want to read the full reports on this particular data, then just click on the globaldrugsurvey.com. You can download executive summary, global reports, and you can request access to different country reports as well. But again, just to end, to say a huge thank you to the fantastic team of people that I get to work with through Global Drug Survey, and thank you very, very much for your time.